This conference will now be recorded.
All right, welcome back, everybody. We are talking chapter 22, which is toxological emergencies. We left off the previous session, finishing up on inhaled poisons. So now we're going to dive into injected poisons. So predominantly the injected poisons that you are going to come across is self-inflicted drug use, predominantly illicit drug abuse. And then as mentioned in the previous section, that a lot of individuals, as far as geriatrics, will attempt suicide by overdosing on their insulin. Other injected poison types that we can see are going to be environmental. So this is going to be related to stings, bee stings, hornets, snakes, what have you. Within our geographical area, we don't have a ton of venomous, poisonous stingers. Down south, when you're looking at rattlesnakes and different things, scorpions, then you're going to see a much more predominant emergency issue with those injected poisons. Based on the patient, remember, we can always see anaphylactic reactions from bee, hornet, and other types of poison from environmental conditions. So we have an injected poison patient. We're dispatched for that. We're going to conduct our scene size up and ensure that it is safe, and then go through our primary and secondary assessment, honing in on our ABCs, and then also our sample history of trying to figure out exactly what type of poison it was, what the onset was as far as when it was taken, and then again, identifying our immediate life threats and reassessing our patient based on any type of interventions. Here we can see an example of a rattlesnake bite. And again, rattlesnakes are poisonous. Not a ton of morbidity and mortality rates associated with rattlesnakes because where they're predominant within the country, EMS services, hospital services are very up to par as far as treatments go. But for snake bites, what we want to do is cleanse that area, clean it, and then go ahead and apply cold packs as far as treatment for pain associated with it. Whenever we suspect any type of venomous snake bite or insect bite, make sure that that individual is being seen within the emergency room setting. So when we're doing our secondary assessment based on our findings and honing in on the specific body system that's being affected, look for these key indicators as far as signs and symptoms go. When we're seeing chills and dizziness and fever, nausea and vomiting, difficulty with the vision, which is euphoria, be suspected that there is some type of poisonous venom that's actually entering the system that's causing that individual disturbances within their central nervous system. And then also where we see fever is that when we have a foreign substance such as bacteria or viruses or poisons, oftentimes our body's going to actually try and combat that issue by increasing the body temperature in order to kill off that foreign substance. Other signs and symptoms that we can see: sedation, high or low blood pressure, needle tracks, specifically with our drug abuse patients, and then also pain at that injection site as well. So what needle tracks are environmental clues, oftentimes bruising and or scarring up and down the forearms from continuous drug use, predominantly with a needle. So our emergency care, first and foremost, scene safety, can't stress that enough. Protect yourself, protect your crew members, and protect your patients. Maintain that airway, specifically as far as the dominant injected poison issue that we come across as of right now in the United States is going to be heroin and opioid-based medications. So first and foremost, it's going to be aggressive airway and breathing treatment. Oftentimes these individuals are not breathing on their own, or if they are, they're breathing at a very slow rate. So go ahead and assist those ventilations sooner rather than later. Again, aggressive treatment on the airway and the breathing and the circulation for that. If we do have drug paraphernalia on scene, go ahead and take some with to the hospital and or have law enforcement secure that and bring it with if you don't feel comfortable with that. So moving on to absorbed poisons. Again, on absorbed poisons, they are going to act much more slowly on the body system in comparison to inhalation and or injection, because both of those body systems, as far as route, they're basically going to enter into the bloodstream instantaneously. So absorbed poisons, they're going to act a little bit slower because they're going through the skin or the mucous membranes. Oftentimes we're going to see either localized reactions to that. I use the example of latex gloves. We could see that interaction with the latex gloves immediately on the skin, or depending on how that individual actually absorbs that medication and how they react to it, we could actually see that systemic or that full body reaction to that. So what we're going to do, we're going to conduct our scene size up, ensure that it's safe, make sure that we're not being introduced to any other poisons that are possibly floating out there. Because let's say it's powder, lime, what have you, that's going to dissipate within the air, and then we can also have a secondary contact from that specific poison. Conduct your primary assessment, our airway, breathing, circulation, ensure that we're going through whether this is an emergent load and go or whether we can stay and play a little bit, perform our secondary assessment, and see if we can actually remove that poison from that patient if it's not already done so. So this is going to be done with heavy amounts of copious water. And again, look for all those different signs and symptoms associated with localized injuries from that poison, and be on the defense as far as looking for those systemic body reactions as well. Emergency medical care, always make sure that we are donning proper PPE. Any type of poisons associated with that, make sure that we're protecting ourselves. Be very mindful of how you're touching yourself when you do have gloves on, and then immediately after you remove your PPE so that you are not cross-contaminating yourself. Remove the poison, ensure that we have proper airway, breathing, circulation. Again, flush with copious amounts of water. Rinse eyes if needed. Be mindful of how you rinse the patient's eyes to make sure that we are not getting that residual water into the unaffected eye. So here we can see emergency care. We got an individual who was exposed to lime on the patient's arms. Go ahead and dry that off, and then copious amounts of water to remove it. If the patient is stable, be mindful of trying to do some research before you actually start looking at interactions with water and the specific poison, because some chemicals can actually react violently with water and can create an even farther hazardous material. So if the patient's stable, if it doesn't appear to be interacting very violently with the patient's skin, go ahead and try and research how to properly decontaminate that specific poison. Eye injuries, again, you can see this rescuer is doing a really nice job as far as trying to make sure that the water runoff is not getting in to the unaffected eye. So this should be used with clean, sterile water. Sterile water comes in plastic containers, which is what the rescuer is holding. So there is no type of environmental openings from that water getting in. Case study conclusion. So we had Trisha and Brian. They began by removing John's clothes and having his mother help with rinsing them in the bathtub to remove any residue. So that's great. We're using a heavy amount of water. We're getting that water runoff isolated to the bathtub. That's going to help with pain. That's going to help with swelling. And that's going to help minimize that poison from affecting other positions of the body. As they do so, they examine him and monitor him for problems with any airway and breathing. EMTs decided to contact poison control. As they have collected additional information, they will include the guidance from poison control in their radio report to medical direction. John's mother left him alone just long enough to put a load of clothes from the washing machine into the dryer. When she returned, she found John with an open bottle of lamp oil. She estimates that the event occurred about 15 minutes ago. 16-ounce bottle was full. Now it appears to have about an ounce gone. It appears that most of the oil is on John's clothes, but she is uncertain whether he ingested any of it. Mother confirms that John is not vomited, but did have a period of coughing before the ambulance arrived. John's airway is open, breathing is normal, clear equal breath sounds. He denies pain in his mouth, throat, and abdomen because the uncertainty of ingestion, the history of coughing, and the potential seriousness of hydrocarbon exposure. Poison control recommends transport. EMTs make sure John is warm. They use the proper pediatric safety support for transport, and then they go ahead and transport that patient to the ER staff. All right, everything that they did totally appropriate. Patient remains stable throughout transport. The patient remains stable throughout care. But again, whenever there's a type of ingested poison, oftentimes medical direction, the ER staff wants to hold that patient and monitor them for a specific amount of time because we don't know when those signs and symptoms are actually going to creep up. Second patient, Warren Mead, traveling on business, staying in a hotel when he starts feeling ill. He becomes nauseated, followed shortly by the onset of vomiting and diarrhea. He has severe abdominal cramping and is beginning to feel as if he has a fever. Oh no, he thinks maybe eating at the buffet last night wasn't such a great idea. So, when we're diving into this case study, how is food poisoning similar to other types of poisoning? So they can replicate very similar signs and symptoms as associated with poisonings from ingestion. As we read the caption, he began feeling nauseous, vomiting, fever. That can also mimic carbon monoxide poisoning, other organophosphate poisonings. Particular concerns with this type of poisoning, specifically food, depending on the food that he ingested. If it was underprepared, if it was chicken, there is a chance of E. coli poisoning. So that is some pretty dangerous bacterial poisoning that's going to infect the GI system. Other signs and symptoms that we might expect to see, depending on how severe the signs and symptoms, they can affect the central nervous system. So we could see that patient start to be altered in some way, shape, or form. So food poisoning, so this is going to be bacteria from that food if it wasn't processed and or handled correctly. Very common occurrence is going to be from seafood and or chicken or dairy products that are left out too long. Specifically in the summer when individuals go on picnics, they kind of forget about mayonnaise. So mayonnaise, once at room temperature, can be dangerous because it can cause food poisoning rather quickly. So these are the different specific types of bacteria that are going to go ahead and affect the GI system of our patients that lead to food poisoning: Salmonella, E. coli, and staph infections as well. So our signs and symptoms that we're going to see: fever from that foreign body substance. That body is going to go ahead and try and kill that off. Could also see blood disorders depending on the poison. Blood in the stool, where it's going to affect the lining of the stomach and the large intestine, small intestine, so we could see blood in there. Abdominal cramping and abdominal pain. Could also see nausea and vomiting, diarrhea, all very broad GI signs and symptoms. So if we are called for this, a lot of this is going to be supportive care as far as emergency care that we're going to provide our patient. Be mindful of hypovolemia, depending on how long that they've been nauseous, vomiting, and experiencing diarrhea. And then also these individuals tend not to keep water down very well, so they're going to be severely dehydrated at the same time. So moving on, the carbon monoxide poisoning, as discussed in our first session on toxicological emergencies, this is going to be the incomplete combustion of fossil fuels. Our body has a major flaw in the system in which we like carbon monoxide 237 more times readily than oxygen. So carbon monoxide binds to our hemoglobin much more readily than an oxygen molecule does. Specific signs and symptoms associated with carbon monoxide poisoning: we can see a headache, increased rate of breathing, nausea, vomiting, and then oftentimes too we see red flushed cheeks. And then our pulse oximeter most often is going to read 100% because all of our hemoglobin are going to be bound to a specific molecule. So first and foremost, as far as emergency care, get that patient out of that specific area if you can, if it's safe, and or if you have the proper PPE to go ahead and don and get that patient out. High flow oxygen, and then transport immediately. Carbon monoxide will sit inside the system for an extended period of time, and basically that patient is suffocating from the inside out. Other types, cyanide poisoning, we don't see it very often. This is also commonly used as far as weapons of mass destruction, but we can also find this in poisons, silver polish, and then also as far as their structure fires go, a lot of times it will actually be produced from burning plastics and synthetic materials. And remember, most of our household materials are from synthetic materials in comparison to our legacy homes, which were basically wood products at that point. Signs and symptoms from cyanide, we have early signs, and then we also have late signs, which is going to be large doses. Cyanide poisoning, oftentimes people complain of a goofy smell as far as almonds, could be difficulty breathing, changing skin condition, altered mental status. So whenever we do this, make sure that we have high flow oxygen going to that patient, and then also specific EMS services will carry a Mark 1 antidote kit for cyanide poisoning as well, not commonly used anymore. So carbon monoxide poisoning, that is true. Carbon monoxide is found in many household products as well as fruit pits. That is not accurate. Carbon monoxide poisoning is asymptomatic. So asymptomatic means without signs and symptoms, and that is not true either. Carbon monoxide poisoning, these patients start to display signs and symptoms very early on with the onset of that poison. Pulse oximetry, unreliable, and carbon monoxide, we know that is true. Or D, carbon monoxide has an odor like bitter almonds. That is actually associated with cyanide poisoning. Correct. Again, it's going to be the interference with the carbon monoxide actually interfering with that. Other types of poisonings, we can see acids and alkalis. So this all has to do with the pH balance system of elements. In order to be neutral, which water is, that's going to be 7. So acidic is going to be low pH, and then alkalis are going to be high pH. So burns, oftentimes contact with acids is going to be about 1 to 2 minutes. Burns with alkalis can be delayed as far as that sensation, and they can last for up to hours on the skin. So what we're going to see as far as signs and symptoms, depending on where that injury site occurred, oftentimes it's going to be isolated. In the event that they inhaled, it's going to affect all of the respiratory system and then also the cardiovascular system as well. Our emergency medical care, so if it's on the skin contact, go ahead and cool that burn site, cover it with a dry non-sterile stick dressing, transport that patient immediately. If it affected the respiratory system at all, make sure that we're assisting in assessing the airway, breathing, and the circulation. Hydrocarbon poisonings, so these are going to be found oftentimes kerosene, lighter fluid, glue and cleaning agents, propellants, other products. You see hydrocarbons in a lot of different areas. This could be oftentimes associated with utilizing our additional resources as far as getting hazmat teams involved. Variety of different routes that this could take place: ingestion, inhalation, and or absorption. Our signs and symptoms are going to be associated with how much that individual actually ingested, inhaled, or came into contact with. But often we can see that there's a variety as far as signs and symptoms go. Severe cases can lead to seizures as well and or coma. And again, they affect the central nervous system pretty predominantly. So what we're going to do, remove that patient from the environment, decontaminate the patient to the best of our ability, making sure that we are not getting that contaminant on ourselves, airway breathing, circulation, and again, rapid transport of that patient. Make sure that with any type of poison, especially anything associated with hazardous materials, that we are letting that hospital know it sooner rather than later so that they can prepare their decontamination process within their emergency room. Other types, methanol. So this is found in gasoline, antifreeze, canned fuels, other sources. So with methanol, individuals who are considered alcoholics may actually utilize it as recreation if they can't get their hands on alcohol. So it does have the same effects as far as the central nervous system goes, but this is acidotic in comparison to manufactured alcohol. Signs and symptoms, very similar to that we would see as far as a patient being intoxicated. We could see an altered mental status, depending on how much that they actually took. We could see seizures as well, blurred vision, difficulty breathing, and then also an increased respiratory rate. What we're going to do, very similar to all the rest of the poisons, maintain the ABCs, and we're going to transport rapidly. Isopropanol or isopropyl alcohol. This is just going to be a rubbing alcohol. Rubbing alcohol comes in a variety of percentages. The percentage of the alcohol is going to be listed right on the bottle. The higher the percentage, the more isopropyl is actually going to be inside that product. It is more toxic than ethanol, and again, it may be intentionally drank by individuals who suffer from alcohol abuse in the event that they cannot get their hands on specific alcohol. Emergency medical care, make sure that we're maintaining our ABCs. Any type of ingested poison, make sure too that we are not inducing any type of vomiting at all. Ethylene glycol, so this is in detergents, where we see this abuse of individuals actually ingesting this. Most commonly, it's going to be pediatrics and kids because it's got a relatively sweet taste. And then also individuals will drink bleach and or detergent because it mimics for drug testing. So it will actually block some of the drug testing capabilities in the event that they're trying to hide that drug test result. So it can be very harmful to the lungs, the kidney, and the liver, specifically the liver too, because it's got to metabolize any toxins that we actually introduce into the system. And that's why alcoholics have predominantly bad livers. Our signs and symptoms, the first stage, it's going to affect the neurological system. The second stage, it's going to affect the cardiopulmonary system. So as far as our cardiac system and our respiratory system. And then the third stage, it's going to affect our renal system, which is going to be in our kidneys. So we can basically look at this from how the poison enters the body. So it's first going to affect our central nervous system, and then it's going to be affecting our heart and our lungs, and then finally our renal system. Emergency medical care, make sure that we're providing supportive care. Be mindful of seizures, or in the event that this individual goes into cardiac arrest, and it's going to be rapid transport. Poisonous plants, oftentimes we're not going to be called to this because this is going to be an isolated or localized injury. Oftentimes with itching, this is going to be taken care of in the urgent care clinic, not necessarily be called for a 911. Suicide bags, chemical suicide by toxic gas inhalation. This was relatively common probably about 5 to 10 years ago, where individuals would mix up a bunch of household chemicals and then release them in their car. Luckily for us, a lot of individuals were cognizant about scene safety, and they would actually label on the outside of their window saying that there is a hazardous materials event inside this car, so please do not enter. Whenever we suspect anything like this, we are not going to enter that scene. make sure that the hazardous materials team is en route so that they can go ahead and mitigate that. What we can do is try and shout from a nearby distance to see if that patient is alert and oriented and go ahead and coax them out of the car. We're not going to enter or provide patient care until hazardous materials actually arrives on scene. Poison control centers we have discussed, and the poison control center, I don't know the number off the top of my head, but again, very commonly used in the event of any type of emergency specific with poisons. So our case study 2, after several hours vomiting diarrhea, Warren feels weak and lightheaded. Being from out of town and having no one to drive him, he calls an ambulance. Warren's vitals appear to be within normal limits. Orthostatic tilt test is positive, indicating that he is dehydrated and lost vascular volume. So the tilt test, what this is doing is we're taking skin and we're pinching it together. And if everybody does that on themselves right now, if you're not dehydrated, that skin goes back to its normal position rather quickly. If we take a patient's skin and we tint it together, so we pinch it, and it's very slow to react, so it kind of maintains that tented position for an extended period of time, it means the tissues are relatively dry and that individual is dehydrated. So the EMTs transport Warren and he gets some IV fluid and antiemetic medication for his nausea and his vomiting, because most likely his vital signs are going to indicate that Warren's blood pressure is relatively low from all the vomiting, diarrhea, and that he doesn't have proper blood pressure. Case study 3, Thomas and Bob respond to a convenience store. Disoriented person was found sitting on the sidewalk. There is a paper bag with gold spray paint on it next to the patient. Patient has gold spray paint around the mouth and the nose. Patient seems confused as Thomas and Bob approach. So clues that the scene tell us about the problems you should anticipate as you assess this patient. We already have the paper bag there. We have indications of drug use with that gold spray paint, both on the bag and on the patient. What treatment should you anticipate this patient? Airway, breathing, circulation, always. And then also proper PPE and making sure that we can decontaminate that patient, and it's going to be aggressive airway treatments. So drug and alcohol emergencies. Significant medical problems associated with both overdose and then withdrawal symptoms. Problems could include as far as altered mental status, respiratory depression, seizures, and then also they can become uncooperative, violent, and angry. So drug abuse and overdose, as far as their medical definitions, drug abuse is going to be self-administration of a drug in a manner that is not accorded with doctors and or medical institutions. Overdose is going to be the involvement of more than what is necessary of a medication prescribed and or street drugs to the point where it goes beyond a euphoric state. Withdrawal symptoms in the period that an individual who is addicted to drugs and alcohol, if they do not have that specific substance within their system for an extended period of time, then they can go into withdrawals. So a lot of different goofy signs and symptoms associated with that. And it's because that patient is so used to having that drug or that alcohol inside their system that when they don't have it in their system, their body doesn't react normally. A variety of different medications and alcohol can cause withdrawal symptoms. As we can see from the picture, we have cocaine, we have ecstasy, we have marijuana. Marijuana, oftentimes we don't actually see withdrawal symptoms from that. So different types of drugs, we have stimulants. So we have cocaine, we have meth. This is going to increase. It's going to be our uppers. So it's going to increase everything within the central nervous system. We have cannabis. So this is going to be our marijuana. Oftentimes these are going to be more downers, but this also triggers the metabolism system. And that's why a lot of individuals eat a lot and or what they say is get the munchies. Depressants our narcotics and our opioids, this is going to bring everything down, our central nervous system and our respiratory system. Oftentimes, we're going to see constricted and or pinpoint pupils. Other depressants, as far as sedatives and tranquilizers, alcohol is a big one. Or antihistamines, these can be abused too. Remember, we use this for allergies, but they do provide a sedative or a depressant effect, so they can be abused as far as Benadryl goes. And then benzodiazepines, these are big ones that individuals take to control seizures. So with sedatives, depressants, oftentimes they have an intoxicated-like state. So slurred speech, drowsiness, impaired thinking, respiratory depression. And then hallucinogens, so we don't see this very often anymore. This was very common and popular in the late 80s, early 90s, where we have LSD, PCP. What this is going to do is it basically creates a mental state for that patient that is out of this world. So they're going to hallucinate and create this whole new picture that is outside of the norm. Then we have inhalants. So this could be aerosol, this could be gasoline, kerosene, whatever somebody can actually get their hands on, and then they huff it, and then it's going to create that high-like state for that patient. So we can see a goofy signs and symptoms as far as excitement, delusions, hallucinations. So moving on to probably the most common drug overdose or drug-related call that we're going to go on is emergencies associated with alcohol. So alcohol is a depressant, it is a poison. Oftentimes this is going to be the culprit effect behind a lot of motor vehicle accidents, homicides, drowning, and or trauma as well. So what we're going to do as far as emergency care, we're going to conduct our scene size up, provide our primary and secondary assessment, get a good physical exam and history and associated signs and symptoms, and then we're going to create our treatment plan based on our primary and secondary assessment. Make sure that when we have these individuals, nausea, vomiting is a very common indicator. So if we don't have to take C-spine precautions, make sure that we're transporting these patients in a left and or right lateral recumbent position. High priority patients associated with this, if we're seeing signs and symptoms associated with an altered mental status or seizures, or there's something wrong with ABCs, this is going to be a load and go type incident.